ADHD is a neurodevelopmental disorder that affects executive function skills, including concentration, impulse control, and organization and planning. In this snapshot, we will be answering the questions: what does ADHD look like clinically, and how is ADHD diagnosed? ADHD is a clinical diagnosis with an estimated 8% worldwide prevalence in children and adolescents. It can present in several ways, including difficulty with concentration or focus, zoning out or excessive daydreaming, irritability or mood changes, or behavior problems related to impulsivity, restlessness, and hyperactivity. Sometimes the affected individual notices the problem and presents for evaluation because it is affecting their ability to succeed at work or school. Other times, a parent or teacher may raise concern and request evaluation. Like evaluation of other psychiatric disorders, it's important to take a stepwise approach to assessment. First, you need to consider if the symptoms represent expected and developmentally appropriate behaviors. Asking about the symptoms in relation to baseline can be helpful. Since ADHD is a neurodevelopmental disorder, it's important to know when symptoms started. Collateral information is usually important. Getting a sense of how the symptoms are impacting the person's life and functioning is essential in ADHD assessment. This can also provide benchmarks for assessing efficacy of treatment if initiated. Some kids with ADHD take much longer to complete tasks, such as homework, than their peers. Others may be unable to sit and sustain attention, which impacts their ability to learn or work. Symptoms of ADHD can be incredibly frustrating, leading to low self-esteem and a threefold risk of depression. People with ADHD may be prone to self-medicate, which in combination with other neurobiological commonalities increases risk of later development of substance use disorders. Many medical problems present with concentration difficulties and behavior changes. Absence seizures is a classic mimicker of inattentive subtype ADHD. People can appear to zone out if they are sleep deprived, have vision or hearing problems, or endocrine disturbances. Like always, be sure to obtain a careful history, vital signs, and physical examination, and let those guide your workup before assuming that psychiatric signs and symptoms are due to a psychiatric etiology. Medications and substances can impair focus and memory or increase restlessness, either by direct or side effects or symptoms of withdrawal. Getting a thorough medication history and timeline of symptoms in relation to starting and stopping medications can be helpful in this assessment. Also, be sure to take a careful substance use history. You also need to assess whether the individual has another psychiatric disorder which would better account for concentration and psychomotor changes. This is done in the psychiatric review of systems. Anxiety is a frequent mimicker and overlaps ADHD. Often, you need to figure out which one, anxiety or ADHD, is driving symptoms of restlessness and concentration difficulties and address that first. This requires a really careful psychiatric history. Getting a timeline of symptom onset can be helpful. Did anxiety start first and the concentration problems always coincide with that? Or is the child more anxious now because they've struggled over a longer time with not focusing and learning well? Depression, psychotic disorders, and trauma are also associated with concentration difficulties. Distractibility and restlessness can be seen in manic and hypomanic episodes of bipolar disorders, although the latter are more cyclical and episodic in nature, whereas the features of ADHD are enduring. As I mentioned before, people with ADHD are prone to developing other comorbid disorders. ADHD is one of several neurodevelopmental disorders. Neurodevelopmental disorders are conditions that affect brain development and functioning and begin in childhood. We will talk about some others in separate videos. ADHD can be diagnosed at any age, but the symptoms trace back to beginning before age 12. Getting a history of symptoms in early childhood is helpful in assessment. Symptoms tend to persist rather than occurring in discrete episodes and need to last at least 6 months before making a diagnosis. Symptoms also cannot just happen in one setting. They need to be pervasive. To diagnose ADHD, concentration difficulties can't just happen at school where, for example, a child may be facing a specific stressor. Evidence of symptoms need to be present in multiple environments. Therefore, collateral information and rating scales are an important component of ADHD evaluation. There are several validated rating scales used to assess for ADHD in different age groups. Some examples of commonly used instruments include the Conners scales, the Vanderbilt scales, the Adult ADHD Self-Report Scale, and the Wender-Utah Rating Scale. There are 3 defined ways that ADHD can present clinically based on predominant clinical features. Inattentive presentation ADHD includes predominant features of making careless mistakes because of poor attention to detail, difficulty in sustaining attention to tasks for long periods of time, not responding when addressed directly, failing to follow through on instructions or finish tasks, trouble organizing tasks and activities, avoiding tasks that require mental effort for any appreciable amount of time, losing things frequently, being easily distracted, and showing a pattern of forgetfulness. A person needs at least 6 of these symptoms. You can imagine that some of these symptoms may not be apparent until a person is in a setting where they need to do a lot of task organization and preparation. It's not uncommon for this subtype to become more apparent later in life, when a task demand increases and certain jobs require more of these skills. This is the type of ADHD that a lot of people commonly call ADD without the H because hyperactivity isn't present. However, ADD is really the same thing as ADHD in attentive type. ADHD hyperactive impulsive presentation also requires 6 symptoms most of the time over at least 6 months. Symptoms include fidgeting or squirming in one's seat, inability to remain seated in situations where really remaining seated is expected, running around or climbing excessively in situations where that would be inappropriate, running around a lot or climbing in inappropriate situations, difficulty playing or engaging in leisurely activities quietly, needing to be doing something on all the time or acting on the go, talking excessively, interrupting or intruding on others, having difficulty waiting one's turn, and answering before the speaker even finishes a question. This subtype tends to be much more observable and bothersome to others, especially in school and many work settings where being quiet and sitting still is desirable. Therefore, the hyperactive impulsive symptoms tend to present for evaluation at much earlier ages than purely inattentive symptoms. If a person meets criteria for both the inattentive and the hyperactive impulsive presentations, the diagnosis is ADHD combined presentation. Everything we listed above is true for diagnosing ADHD in children and adolescents. However, at age 17 and above, only 5 criteria are now needed for each category for diagnosis. You should still assess for evidence of some symptoms prior to age 12 by asking about childhood and middle school functioning, ensuring that symptoms have been present for at least 6 months and are present in more than one setting. Here is ADHD tucked back into our overall framework. It is a neurodevelopmental disorder that starts in childhood, and symptoms often persist into adulthood, although can become subclinical over time as people learn to adapt. To summarize, ADHD or attention deficit hyperactivity disorder is a neurodevelopmental disorder characterized by inattention, hyperactivity, or both. The symptoms must impair functioning and be inappropriate for a developmental level. ADHD can be diagnosed at any age, although there needs to be evidence of symptoms before the age of 12. ADHD is diagnosed clinically, and collateral information is really important. Labs, imaging studies, and other diagnostic tests can evaluate for other causes of attentional difficulties, but do not themselves diagnose ADHD. Symptoms are chronic and do not just occur situationally in one setting, such as just at home or just at work or just at school. Up to age 17, 6 or more symptoms from inattentive or hyperactive impulsive categories need to be present. 5 symptoms are sufficient for diagnosis in age 17 and over.